Motherhood Hospital, Lulanagar, and I'm practicing in this field since last 12 to 15 years. And I did my MBBS and DNB, and my special interest, especially for high risk pregnancy, infertility, laparoscopic surgeries, and routine women screening test and cancer screening. So today I'm here. Thank you so much to Baby Chakra also invited me here to talk about the what to avoid when you are planning for the pregnancy. Because many times nowadays all of patients, they are very well aware, they are very well educated, they are coming to us especially in OPD when they are planning for the pregnancy. Doctor, हमें क्या करना है, क्या नहीं करना है, what test to be done to check that my wife, she is healthy, if she is planning for the pregnancy, स्पेशली हमें पर्टिकुलरली क्या अवॉइड करना चाहिए और हमें कब प्लान करना चाहिए, ये एज परफेक्ट है क्या प्लान करने के लिए. दिस लॉट्स ऑफ क्वेश्चंस आर देयर इन couple who are planning for the pregnancy. So today I will talk about it, what to avoid when you are planning for the pregnancy. Okay, so first of all, I will brief about it कि आपको क्या avoid करना है, और not only avoid, आपको क्या करना चाहिए when you are planning for the pregnancy. We know कि जब भी कोई couples आते हैं या कुछ like with 50% in India, people are not planning for the pregnancy, they conceive, or either they're just they are like planning for the pregnancy. But few couples, they are educated and they are coming to us for the counseling, for the checkups and all. So whenever you are planning for the pregnancy, first very important that you to go and consult the gynecologist to check the health of for the wife and for husband also, that how safe it is for both of you that you are planning for the pregnancy. Well, important ये है. Second, suppose if you are planning for the pregnancy, तो जब आप when you are going to the doctors, there will be some question answer from the couple side also. Doctor also will give you some tips कि आपको क्या करना है और क्या नहीं करना है. तो जब भी कोई कपल्स आते हैं और कपल देन दे आर प्लानिंग प्रेगनेंसी के लिए, तो उसमें हम सबसे पहले उनको बोलते हैं कि आपका एज क्या है, एंड टेकिंग देयर प्रॉपर हिस्ट्री कि उनको कुछ मेडिकल प्रॉब्लम है क्या, वाइफ शी इज टेकिंग एनी मेडिसिन फॉर एनी मेडिकल प्रॉब्लम, और if she is having any health issues related to her physical health or the mental health, or either the husband also, because not only the wife, the husband is also equally important when you are planning for the pregnancy, to check for both of health. तो उस केस में आपको कुछ few first pulse, BP, your weight very important. तो suppose आप प्लान कर रहे हैं प्रेगनेंसी के लिए और your weight it's very very important. तो suppose if you are overweight or you are underweight, when your BMI is more than 30, or if your BMI is less than 18 or 17, you are underweight. Both the conditions are not good when you are planning for the pregnancy. तो जब आपका वेट ज़्यादा होता है वो भी अच्छा नहीं है, कम होना भी अच्छा नहीं है, because there's a lots of complication in the pregnancy. तो अगर आपका वेट ज़्यादा साइड पे है तो आपको पहले वेट कम करना चाहिए. आप if you are taking lots of junk food, if you are not doing any exercise, you have to reduce the weight first of all. For that, if you are doing any exercise, you continue with your exercise, आपको जिससे कि आप अपना वेट कंट्रोल में रख सकें. When you are entering into the pregnancy, you are going to be healthy. Because main message first important कि suppose जब भी आप प्लान करते हो प्रेगनेंसी के लिए, if mother is healthy, baby is going to be healthy. So जब आपकी जर्नी हेल्दी होगी तो डेफिनेटली योर फुल प्रेगनेंसी 9 months, even after the delivery, you and mother both are going to be, the baby and mother is going to be healthy. Second, related with the food, lots of questions are there from the couple कि मैम हमें क्या खाना चाहिए, हमें अभी से क्या स्टॉप करना चाहिए जो बेबी के लिए हेल्दी नहीं है या हम प्लान कर रहे हैं। डेफिनेटली एंड स्पेशली इन इंडिया वेयर वी आर हैविंग सो मेनी ट्रेडिशनल, कुछ साउथ इंडियंस लोग रहते हैं, कुछ नॉर्थ इंडियन है, सम महाराष्ट्रियन, तो उनका कुछ टेबूज होता है कि डॉक्टर हमें ये नहीं खाना है, अगर हमने ये खाया और हम प्रेगनेंसी का प्लान कर रहे हैं तो क्या बेबी को अफेक्ट करेगा। मोस्ट डेंजरस थिंग जो आपको प्रेगनेंसी में अवॉइड करना चाहिए, वन इज लाइक अवॉइड द एल्कोहल एंड द स्मोकिंग, टू इम्पोर्टेंट थिंग। बिकॉज ऐसा नहीं है कि नाउ डेज नॉट वेरी अनकॉमन कि कपल्स या जो वीमेन होती है दे आर नॉट डूइंग इन स्मोकिंग एंड ड्रिंकिंग, डेफिनेटली दे आर डूइंग द स्मोकिंग एंड ड्रिंकिंग। लेकिन आप जब आप प्लान कर रहे हो बेबी के लिए, आपको स्मोकिंग भी बंद करना है और आपको ड्रिंकिंग भी बंद, एल्कोहल भी बंद करना है, बिकॉज बोथ आर डेंजरस फॉर यू। कोई भी जो गर्ल्स जो प्लान करती हैं बेबी के लिए, सपोज इफ यू आर डूइंग द स्मोकिंग, इट इज नॉट गुड फॉर यू, it will lead to the infertility problem. Suppose if you are smoking during the pregnancy, tobacco, that is nicotine, through the blood it is going to the baby and it causing hypoxia and damage to the baby. You have to stop the smoking, you have to avoid the alcohol, because if you are taking the alcohol, even the small quantity of alcohol, it is not good for the baby. This alcohol, it is causing some congenital abnormalities in the baby, so you have to avoid this, what the things. Third, related to your weight, you have to control your weight. If you are overweight, if you are obese, or you are underweight. If you are underweight, try to put on little bit, because you already, if you are weak, your weight is just 30 kg, and if you are planning for the baby, it is not good for the baby development. And then in most of time during the pregnancy, you will feel weakness or giddiness or fatigue. So maintain your weight. Other most important thing to avoid during the pregnancy, suppose if you are taking any medication related with your medical health problem, or if you are having the habit, because काफी लोगों का इंडिया में हैबिट होता है कि वो कुछ मेडिसिन लेते हैं या लाइक दे आर टेकिंग एनी मेडिसिन, दे आर नॉट आस्किंग बिकॉज इट्स अवेलेबल ऑन द मेडिकल शॉप, बाहर इजीली मिल जाता है, डॉक्टर मुझे खांसी जुकाम हुआ, मैंने गोली ले लिया या कुछ मेडिसिन ले लिया। बट जब आप प्लान कर रहे हो प्रेगनेंसी के लिए, यू हैव टू स्टॉप टेकिंग दैट मेडिकेशन, going to the medical and just stop taking that medications. Go to the doctor if you are having any medical problem, and doctor gynecologist will prescribe you the medicine that is safe for you and for the baby. So आपको on the counter medicines नहीं लेना है. Third, next, suppose if you are planning, complete your vaccination, because suddenly the couples आते हैं, they are not immunized for the rubella. Rubella is a viral infection. And nowadays, whenever couple are coming for the counseling, we are asking to go the rubella antibodies test. And suppose if rubella antibodies test is negative, you can take this vaccine. It is available with the gynec. It is available in the hospital also, and this will prevent the baby intrauterine from some particular rubella infection that is very dangerous for the baby, and it leads to some congenital abnormality. So when you are planning, you take this vaccination. Suppose if you are not already immunized, if you are already immunized, it is fine. If you want to take any hepatitis vaccine or any other vaccine, take it before the pregnancy, because in pregnancy it is not allowed to take any vaccination until unless it is safe or it is like recommendation by the doctor, then only you can take the vaccine. Next, nowadays, because increasing age, what to avoid? Avoiding is like, suppose if you are planning for the pregnancy, you are married since 4 year, 5 year, your age is now more than 35 or 30 year of the age. Try to plan the pregnancy if you are okay before the 30 year of the age. At least first pregnancy, first baby, you try before 30 if it's possible for you. If you are working, if it is not possible, at least before 35 year of the age, plan for the pregnancy. That this is beneficial for the baby and for mother both, because it will help to prevent some chromosomal or some Down syndrome, some abnormalities. Because mothers, especially who are more than 35 year of the age, they are more prone for the congenital abnormalities in the baby. They are more risk for the diabetes and blood pressure during the pregnancy, and they are having more complication compared to the mother who are younger than the less than the 35 year of the age. Then next, suppose many patients, they are having some chronic illness, asthma, diabetes, even before planning for the pregnancy. So they are more worried during the pregnancy कि डॉक्टर मुझे ये मेडिसिन लेना है. Many patients, they are having epilepsy problem, diabetes, high blood pressure. Many patients, they are having the asthma problem. तो सडनली उनके दिमाग में आता है कि नो, अच्छा अभी माय टेस्ट इज पॉजिटिव और शी इज प्लानिंग फॉर, दे आर नॉट कंसल्टिंग द डॉक्टर, दे डोंट बॉदर अबाउट इट, and suddenly they are stopping the medicine, and this medicine is life saving for the women. So don't stop any medication that is life saving for you, but in that case you go and consult your physician, consult the gynecologist. They will change your medication. Suppose if you are on the anti-hypertensive blood pressure का आप medicines लेती हो, और suppose the medicines is not safe for the baby, the physician or the gynecologist will change your medicines and they will give the medicine that is safe during the pregnancy. So whatever medicines you are taking, go and ask your doctor either that is safe or no, but don't stop any medication suddenly by yourself that it is not safe, it is going to affect, because otherwise you will ended up with some medical problem or some complications during the pregnancy, even before the pregnancy, planning for the pregnancy. Don't take any illegal drugs. As you all know, this illegal drugs or alcohol or smoking, it is not good for the developing baby also. So you have to stop all this medication. And next, the question is like most patients that are so much active before the pregnancy. They are doing the swimming, they are doing the lots of exercise, they are going to the gym also, doing the heavy lifting. And तो उन लोगों का क्वेश्चन होता है कि मैम क्या हम एक्सरसाइज कंटिन्यू रख सकते हैं, सपोज अगर आप कंसीव हो जाती हैं और इफ यू आर प्लानिंग फॉर द प्रेगनेंसी, तो उन लोगों का होता है कि मैम हम ये एक्सरसाइज कंटिन्यू रख सकते हैं और हमें बेड रेस्ट का जरूरत है. Any exercise mild to moderate, like suppose if you are doing the walking, it is safe during the pregnancy. If you are doing the light exercise, yoga, if you are doing the swimming, these all exercises are safe during the pregnancy also, before planning for the pregnancy. But if you are doing very heavy exercise, like you can say the running for 15-20 kilometers, or if you are doing too much workout in the gym, like heavy weightlifting and all, this is not good, because suppose if you conceive and you are not aware about it, and if you are lifting so heavy weight and all, there might be chances, probability that you will end up with some miscarriage and all. So mild to moderate exercise, 30 to 45 minute exercise, in fact it is good and benefit for you and for the baby also. This is very important. And when you are planning okay, then next, like विटामिन्स. नेक्स्ट क्वेश्चन कि डॉक्टर हमें कुछ विटामिन सप्लीमेंट्स लेना है क्या, या वेरी इंपॉर्टेंट प्रीनेटल विटामिन यू हैव टू टेक, दैट इज अ फॉलिक एसिड. व्हाई इट इज वेरी इंपॉर्टेंट? बिकॉज पेशेंट्स होते हैं, कभी क्वेश्चन पूछते हैं कि मैम ये क्यों मेडिसिन आप पहले दे देते हो, अभी तो ये कंसीव ही नहीं हुई है, पेशेंट इज नॉट कंसीव. This folic acid, it is a it's a vitamin. This is helpful for the baby to prevent some congenital abnormalities, especially the neural tube defect. जो बेबी का स्पाइन बनता है, जो बेबी का ब्रेन बनता है, उसको प्रिवेंट करते हैं. तो सपोज अगर आप ये मेडिसिन जो फॉलिक एसिड है, यू आर स्टार्टिंग 2 or 3 months prior to your conceiving period, already the effect is there in your body. Because as an Indian, जब भी हम कोई मेडिसिन फूड लेते हैं इंडियन, इट्स लाइक हम लोग उसको बहुत ज़्यादा कुक करते हैं और वॉश करते हैं. ग्रीन लीफी वेजिटेबल्स में फॉलिक एसिड बहुत ज़्यादा होता है, बट व्हेन यू आर वॉशिंग एंड कुकिंग देम, लाइक वो पूरा वॉश अवे हो जाता है. द विटामिन इज फॉलिक एसिड विटामिन इज नॉट प्रॉपर्ली अवेलेबल इन आवर डाइट, सो वी हैव टू टेक एक्स्ट्रा सप्लीमेंट टू प्रिवेंट सम न्यूरल ट्यूब डिफेक्ट इन द बेबी. So better you double your doses if you are taking some, if you are having the vitamin D3 is very low in your body and you just checked it, better continue with the calcium supplement and vitamin D3 along with the folic acid tablet. So you double your vitamins and the nutritional supplements when you are planning for the pregnancy also. Next is like pregnancy care checkup. Okay, many question, this question is like कि मैम हमें प्रेगनेंसी केयर जो प्री प्रेगनेंसी केयर में क्या चेकअप्स करने हैं. Well, जब भी आप डॉक्टर्स को विजिट करते हो, वी आर गोइंग टू गायनिक, they will check your weight, they will check your blood pressure, because many patients they are not aware कि उनको बीपी है क्या, शुगर है क्या. So we asking them to go for the basic investigations like hemoglobin, that you are not anemic, your hemoglobin is perfectly okay. Your sugar, your vitamin D3, calcium, vitamin B12, and thyroid also, because this is very common. And previously, जो मैंने आप लोगों को बताया कि rubella vaccine, so we are doing the rubella antibodies test also, that is IgG test. If you are already immunized, the antibodies is going to be positive, no need to go for vaccination. Suppose if it is negative, In this case, then you have to take the rubella vaccine. Other tests like urine to check for any infections, your hemoglobin, it's very important because in India, most of women, they are already anemic. The hemoglobin is almost 9 or 10 or maybe less than 9 also. So जब आप प्रेगनेंसी के लिए प्लान करो और ऑलरेडी योर हीमोग्लोबिन इज लो, you will feel more sick during the pregnancy. So this is the basic investigation along your BMI, your weight, and the blood pressure. If you are having any problem related to your sexual life or any discharge from the vagina, might be chances that we will do the pap smear test to check for any cervical cancer or any infection is there into the vagina. These are the all pre-pregnancy care checkup that you have to do before planning for the pregnancy. So what you can do to be healthy before the pregnancy? Three things whenever you're planning for the pregnancy. One, very important, I always first try to maintain the ideal weight, good weight and good health. That is very important. Third, continue with your exercise and yoga. Even if you are not doing any exercise yoga, better start before planning for the pregnancy. Otherwise, during the pregnancy, you will have the severe back pain, you have the joints pain, might be you are suffering from lots of issues also. And third is your diet. Watch what you are eating, because now before the pregnancy you are eating for you, but definitely whatever your habit in the future, it is going to affect your baby. So watch what you are eating. Eat the healthy diets, lots of green leafy vegetables, protein diet, fruits, fruit juices, and the vegetable. This is very important that you have to watch for three things: exercise, diet, and weight control. If you do these three things, your pregnancy is going to be healthy. About the weight that I already discussed with you, weight is very important concern. BMI, that is because it's very easy to check the BMI. Your weight divided by height into the meter square. Suppose if your BMI is in between, you can say 19 to 25, we consider normal BMI. If your weight is 25 to 30, you are already in overweight. ठीक है, overweight तक भी you can plan, but ऐसा नहीं कि because sometimes patient they take 3 months or 6 months for the conceiving, and if you are in very hurry to planning for the pregnancy, तो आपको अपना थोड़ा weight पे control करना है, अपनी diet पे control करना है, and already if you are obese, first wait before planning for the pregnancy. Try to reduce your weight at least minimum. Suppose if your weight is already 70 or 80 kg and your BMI is more than 30, try to reduce at least 5 to 10 kg or 15 kg weight, then plan for the pregnancy. So you try to reduce your weight. That is very important. If you are underweight, take some protein supplement. Your weight is 30-35 kg. You take some protein supplement and then plan for the pregnancy. So you will be healthy during the pregnancy. Yes. Underweight, because always you talk about the overweight and obesity, but few patients, their weight is on the lower side. That is we call the less than 18 BMI. Suppose if your weight is on the lower side, it is not good because already your muscle mass is very less, your bone is weak, because whatever your BMI, it is not adjusting your body. And when you are planning for the pregnancy, might be chances in the future you are having the anemia, hemoglobin is less. Sometimes you are having the hyperemesis gravidum, lots of vomiting in pregnancy, because हम maximum लोगों ने OPD में देखते हैं कि जो patients का weight बहुत कम होता है, they are suffering from the lots of vomiting and nausea sensation, lots of weakness, fatigue. They are not able to do work properly, and in the future this leads to the high blood pressure and other complications also. And IUGR in a small baby weight is not properly developing. So if you are underweight, first correct your weight, then plan for the pregnancy. Vitamins, yes. When you are coming to the, you are consulting the doctor. If you are not consulting the doctor, but better always consult the doctor, gynecologist when you are planning. You take the vitamins. In fact, you double your vitamins doses. Suppose if you are taking B complex, very common nowadays, especially अभी जो last 2 years से जो COVID का time चल रहा है, all families they are taking vitamin C, they are taking vitamin D3, calcium and everything. So it is very important if you are taking any supplement. Very good that if you are already taking, and if you are not taking also, start the folic acid. That is very important. Better start. If you are anemic, you take the iron supplement also. That will help to build your hemoglobin is good. And other is the calcium supplements, because as a Indian we are having very low calcium and vitamin D3 and lots of back pain and the joints problems are there. So if you are deficiency in that, you start with the calcium supplements also. But folic acid is very important that you have to start before planning for the pregnancy. अभी स्टार्टिंग में आप डिस्कस विद यू कि एज मेडिकल साइंस इज एडवांसेस, अभी काफ़ी हम एडवांस लेवल पे पहुंच गए हैं. कुछ पेशेंट्स इस लेवल के भी हैं कि जिनका किडनी ट्रांसप्लांट हुआ है और दे अंडरवेंट फॉर द मेजर कार्डियक सर्जरी. Many patients are having severe hypertension. Hypertension was itna high blood pressure, the patient was in ICU previously, and some other problem. Still, they are planning for the pregnancy. And the diabetics is very common in India. Almost 4 में से 1 women they are having the pre-diabetic one before planning for the pregnancy. They are having the high sugar. So, if any chronic medical condition if you are having during the pregnancy, the first important you go and consult the doctor, gynec also, and if you are consulting with a physician or diabetologist or endocrinologist, consult the doctor first, treat your condition. If your blood pressure is very high, if your diabetic level is very high, sugar level is very high, it is not good for you. It might be chances that you will conceive, but it is very dangerous for your health and it is very dangerous for the baby. If your sugar is high, baby will develop some congenital problems, some heart problems, some abnormalities. If your blood pressure is very high, during the pregnancy it's very difficult to control the blood pressure and the baby is going to be IUGR baby or some water around the baby is very less. So whatever medical condition if you are having, take the medication. Now we are in medical science, we are having very good and safe medicines for each and every chronic problem. You can take this medicine safely. आप ले सकते हो अगर डॉक्टर ने रिकमेंड किया 100% विदाउट एनी स्ट्रेस एंड देन प्लान फॉर योर नेक्स्ट जर्नी. अभी like few patients they don't believe in allopathic medicines. Definitely they उनका क्वेश्चन होता है मैम मैं दिस कंपनी का जो है आयुर्वेदिक प्रोटीन पाउडर लेती हूँ और पंचकर्मास एंड दिस वन और होम्योपैथिक और दिस सप्लीमेंट. फर्स्ट ऑफ ऑल डोंट जंगल ऑल दिस थिंग, डोंट मिक्स ऑल दिस थिंग्स कि मैम मैं ये भी ले लेती हूँ, मैं ये भी ले लेती हूँ, मैं भी ले लेती हूँ. You first important you take what is important for the baby. Important is for the baby is the folic acid that I already told you about this. दूसरा होता है herbal remedies and supplement. There is no search or no research on this how safe it is for the baby. Definitely if you are 100% sure that this is safe, this is 100% natural content, then only take it. But if you are worried कि अच्छा मैं कुछ पेशेंट्स होते हैं कि नहीं मैम बहुत ज्यादा लिया तो बेबी के ब्लड डेवलपमेंट के लिए अच्छा रहेगा, हम वी विल टेक द दिस मेडिसिन और विल टेक मल्टीविटामिन, उसके साथ में वो कुछ किसी कंपनी का प्रोटीन पाउडर लेंगे या फिर किसी आयुर्वेदिक डॉक्टर ने उनको कुछ बना के दिया है. नॉट वी आर नॉट अवेयर अबाउट इट कि वो सेफ है या नहीं है. If you are feeling you want to take it, you take it, but don't take too many medication together because that is not safe during the pregnancy. Then about the vaccination, yes, like you can Rubella vaccine. Suppose if you are planning for the pregnancy, you can go for the Rubella vaccination. It is very important. You check your antibodies and then go for the Rubella vaccine. Suppose if you are planning for the hepatitis or any other vaccine, if you left, suppose you want to go for the cervical cancer prevention vaccination and all, you can take that vaccine and then plan for the pregnancy. Because all this vaccination it is not allowed during the pregnancy, so better go for the vaccination, complete your list of vaccination and then plan for the healthy pregnancy. So as a gynecologist, my message to all beautiful ladies who couple who are planning to pregnancy, like if your journey like whenever you are going to the any out of station or anywhere, if we are planning from 1 month before or 2 months before, our journey is going to be joyful and stress free. Same like a pregnancy. Pregnancy is a journey for the 9 month. It is not only for 9 month. You can consider 3 months before you are planning for the pregnancy and even after the birth of the baby. So suppose if mother is healthy, uh, baby is going to be healthy, most important. So start your motherhood journey with the healthy habits, with healthy diet, exercise, and do all the checkups. and then enter into the pregnancy. So suppose if you're starting with the healthy motherhood journey, outcome is going to be healthy and baby is going to be healthy. That's it. This is my message to all the couple who are expecting or you are planning for the pregnancy. Thank you. And if any questions from audience, please let me know. Thank you so much.